My name is Dr. Joe An. I'm a cardiologist at Medicor Cardiology. I'm a practicing cardiologist predominantly out of a community hospital in Somerset County, New Jersey. So I think my experiences with the COVID pandemic has ran the whole gamut from personally having had COVID to treating patients with COVID. Our practice was surprised, like a lot of places, where if I look back at the beginning of COVID, we were trying to heed warnings about what's happening in Europe. I remember one of my colleagues telling us that this would be coming to the United States and that we should be prepared and we should be wearing masks. And like a lot of us, we were kind of scoffed at the idea. We didn't think patients would be comfortable with the notion of wearing masks. So unfortunately, 2 weeks later, the country pretty much shut down. And we as a practice went into that mode as well. It was during that time that I actually was found out I was diagnosed with COVID as well, and I was home recuperating. During that time, our office were doing mostly virtual visits, something that we had never done before. I think a lot of patients appreciated us being open and available. And at first, it was pretty difficult to have the same type of patient interactions that we would want having virtual visits, but fortunately, with quick adaptation, with getting a lot of the technology up to date with video conferencing, we're able to try to continue administering healthcare to our patients. And fortunately, we never really actually closed. There were patients who had to be seen, patients who were post-operative, patients that had emergencies, and I'm proud to say that we as a practice made adaptations and stayed open, but there was probably a 2-3 week window where predominantly our patients were virtual visits. Clearly, a lot of what we do relies on both patient history, which we can do over the phone, over video conferencing, but also a lot of what we do is acquisition of data, whether it be an EKG or physical exam, and that's also an integral part of delivering healthcare. And so there were situations that we could do when patients were having somewhat more well checks, where we were renewing medications and making sure there was no alarming symptoms. But it was a little difficult, and I think we did a pretty good job, but at the same time there definitely is a limitation, and certain types of visits are more conducive to a virtual visit, and clearly some visits are much better done in person. Well, I like to think that my experience having had COVID has made me a better doctor, but clearly going through it was unnerving. I was one of the first doctors in our practice, or at least in our community, that had COVID, and subsequently there was not much that we knew about COVID in terms of treatment options. Getting tested at that time was also very difficult. So finally getting tested, having a diagnosis, and recuperating at home, it wasn't easy because I wasn't sure of anything, what would happen. Fortunately, my course was not serious. I did not require hospitalization, and I was in kind of out of commission for about 2 weeks, but it took me probably about 2 months to fully feel like I was back to myself. And I think that helps me empathize with patients that I see now who are going through COVID, or both in the hospital and as an outpatient, because they want to hear from their doctors who they trust that, hey, you know, this experience is universal. Some people take a longer time to get better, and I can sort of share in that with them. Well, I think that in medicine, and at least in training, people go through different health crises. When I was an intern and resident, the issue then was the sort of the tail end of the HIV/AIDS epidemic. And obviously people learned a lot and treatments have improved, and that has sort of become better controlled. Having gone through COVID now, I think we've also learned a lot. And again, part of what we do as healthcare workers is that we do take risks. But fortunately, with better education, better science, we understand what those risks are. Currently, I do still wear a mask, despite having had COVID, having had the vaccine, because these are kind of universal precautions that we want to keep doing. But in terms of fear of practicing, I don't think I'm afraid of continuing to practice being a physician, but definitely more aware. It is a very legitimate concern, however. I can understand at the time that this was all happening, when we didn't have a grasp or have a good control of COVID, the idea of going to work, being potentially exposed, coming home, hoping not to expose my family or my close friends was a real concern. And so we all took similar stories of taking off all our clothes in the garage, getting desanitizing immediately. And frankly, I probably understood when people in my family probably didn't want to be too close to me in the beginning. But I think that as we've sort of learned more and understand more, I think that we have a better grasp of the situation. I definitely agree with the idea that the best vaccine for you is the one that's available for you. And for me, the Pfizer vaccine was available. There's some recent data showing that, and I think anecdotally we know that patients who had COVID, when they get the vaccine, they have more of a reaction, they have more of a stronger immune response. And I did have such, where the initial vaccine did make me feel a little unwell, and the second one was definitely stronger. And again, I think part of this is getting us more aware. I know there's, I'm a participant in a research study based out of Robert Wood Johnson Rutgers Medical School, where we do monthly surveys on how response to both COVID and how things are going on with the vaccine. So I like to think that my experiences are contributing to gaining that more information. But I definitely feel that the vaccine is an important part of how we can get better control and ultimately build up to developing what we're hoping for, which is a herd immunity. Well, I think looking back at the past year, I think it really is a testament to our practice, the staff, all the essential workers in the hospital, in our offices, and how well that we really kind of came together to get through this very, very difficult situation. I'm glad that I can say I'm part of this family in our practice, and that we all look out for each other, and we've gotten through this difficult situation. And I am optimistic that as things are improving with vaccine delivery and more science, that we are going to be coming through at the other end of this, and that hopefully I'm hoping that COVID will be behind us very soon.